Thanks for listening to the Lunch and Learn with Dr. Barry, here to help educate, motivate, and put you on the right path to take control of your health through weekly discussions on topics in the medical field, public health arena, and in your community. And now your host, Dr. Barry.
And welcome to another episode of the Lunch and Learn with Dr. Barry. I'm your host, Dr. Barry Pierre, your favorite board-certified internist, founder of drbarrypierre.com, as well as the CEO of Pierre Medical Consulting, helping you empower yourself for better health with the #1 podcast for patient advocacy, affirmation, and education. This week, we are going to be talking about colon cancer. More importantly, what is colorectal cancer? We're going to give a broad definition. Let's get some facts. Let's get some figures. Let's get some famous people affected with colon cancer, especially during the month of March, right? Which we all know, or we should know by this time, is Colon Cancer Awareness Month. So what I need you to do for me is make sure to subscribe to the podcast. Leave us a 5-star review wherever you plan on listening to the podcast app. Make sure you tell 10 friends. And more importantly, make sure you look at your family members, especially your older family members, depending on how old you are. Maybe your older family members who have maybe not gotten their colonoscopy done, their colonoscopy screening up to date. Get them up to date, because this is a disease process that is the third most leading cause of cancer-related death here in the country for men and women, right? So it's an important disease that we need to be proactive for. Remember, we're going to empower ourselves for better health. We want to empower ourselves with the knowledge, right? To protect ourselves, to save ourselves in the future, right? So you guys be blessed. Let's get ready for another amazing episode today. Today's episode is sponsored by the inaugural Autism in Black virtual conference. It is from April 1st to the 4th. It is a virtual conference going to be hosted by Maria Davis Pierre, who is the CEO of Autism in Black. Get ready to join over 15 esteemed guest speakers who are going to help empower us. Guys, you know my motto, empower yourself for better health, who are going to help empower us to help serve our communities and our families who have the blessed opportunity to work with those in the autism space. General admission tickets are $99 and VIP tickets are $247. Go ahead and check out the link, which will be in the show notes, or go to drbarrypierre.com/AIB conference for more information. All right, so today we're going to be talking about colorectal cancer, and let's start out with the definition, right? I think the first and foremost is, when we think about cancer just in general, what is cancer? Just kind of plain and simple, is the abnormal growth of cells, right? That, again, is just abnormally growing when it should not be growing. And unfortunately, when it develops in this point, especially from a malignant standpoint, this is where we have problems, right? So, of course, when we think about colorectal cancer, it is the abnormal growth of cells in the colon as well as the rectum. And I'm going to talk a lot about colorectal cancer because even in the medical field, I think a lot of times we kind of combine the term when it's really two separate processes. And especially when we talk about treatment process, it's actually two different types of treatment, really depending on the location of the disease, right? So colorectal cancer is the cancer of disease, especially affected in the colon as well as the rectum, right? So let's give some facts and figures. And you guys know I'm very big on, kind of helping you get a broader picture of why we stress, the medical diseases that we stress, right? So let's take a quick look here, right? So colorectal cancer is the second leading cause of cancer deaths here in the United States among men and women, right? And not only is the second leading cause of cancer-related deaths, it's the second most common cancer in men and women, right? So it is a disease that is clearly affecting a lot of people here in this country and really even across the world. So you would expect it to get this fanfare and get a whole month really kind of dedicated to itself. More importantly, 25 to 30% of colorectal cancer patients have a family history of disease. Reason why this is important is because we're going to be talking about, especially when we kind of go into the risk factors aspect, we're going to be talking about what are some of the risk factors associated with colorectal cancer. And as you can see here with a number like this, 25 to 30% of colorectal cancer patients have some family history, which is why when I'm talking to patients, I'm always asking them, do you have any family members with kind of stomach related disease, colon related disease, because that will clue us in as a physician, who we need to be much more diligent on and aggressive with. 1 in 23 women and 1 in 25, 1 in 23 men and 1 in 25 women will be diagnosed with colorectal cancer, right? And that kind of, again, just kind of goes to show you when we talk about just how common this cancer related process is, why we should be really stressing, that aspect of it. And this is what, as a public health professional, right? As a public health professional, this is what really, saddens me when we talk about colorectal cancer. Colorectal cancer is preventable with screening, and affordable take-home tests exist, right? 1 in 3 people are not up to date with colorectal cancer screening, right? That is the problem, right? And I think when we think about, all cancers, and if you had to say, Doc, what's one cancer that if I had to choose a cancer, what would I choose? We know colorectal cancer is one of these more slower growing cancers, meaning that if you are proactive in its approach to try to prevent it, you have a great opportunity to do so. And 60%, right? And this is the CDC numbers actually are closer to 70%, right? But I'll just say between 60 to 70% of colorectal cancer deaths could be prevented with screening. Right. So imagine with the number of cancers that we diagnose every single year, imagine if you could just prevent 60% of them just by adequate screening. Right. And that's really the problem that we lie at hand. Right. Is because we have a cancer that we know if we're aggressive in preventing it, we can save a lot of lives, and we're still not doing a very good job, at that. And one that really hits close home to me is that Black Americans are more likely to be diagnosed and die from colorectal cancer than most groups, right? And less than 50% of Asian Americans are up to date with colorectal cancer screening. So when we talk about the Black Americans, right, what kills us, right, is when we don't get screened enough, right? When we're not, getting screened, we're not getting the adequate testing to try to prevent it. And then when you think about, well, okay, let's say we don't have that adequate screening, but let's say we do get the screening, we're catching it at a later stage. So not only are we being diagnosed later, because we're being diagnosed later, there's less treatment options for us, right? Which is why we're dying at a much higher clip than other groups, right? And I think this goes to show, which makes common sense, right? Indigenous communities have higher rates of colorectal cancer than their white counterparts, right? We know white counterparts typically have more access to healthcare, and if they have more access to healthcare, they have more access to screening, they have more access to education, right? That can, that will always help prevent us downwind. I talk about this all the time, especially when I'm talking about blood pressure issues, right? We know that when it comes to blood pressure, that if I just give you one pill, right? One pill that's like free at some of these pharmacies, right? That I can prevent you from having a heart attack in 10 years. I can prevent you from going to dialysis in 10 years. I can prevent you from having a stroke in 10 years, like with just one little pill. But if you never get that one little pill, if you never get that education that says, decrease your, if you never get those types of things, it doesn't matter. So we know that having access to healthcare is such a huge factor, especially when we talk about colorectal cancer. And when we have here this onus of, some communities get and some communities don't, you kind of see where we're at here, right? And more importantly, this is another factor that I thought Ashkenazi Jews have one of the highest colorectal cancer risk ethnic groups in the world, right? So again, colorectal cancer, again, the numbers are unfortunately astonishing as far as, who's affected, how many are affected. And these are just 2020 numbers, just so you guys can get an idea. In 2020, approximately 104,000 new cases of colorectal cancer colon cancer was diagnosed, with about 43,000 cases of rectal cancer being diagnosed, and about 53,000 people died last year from colorectal cancer. Remember, we said that if we could just prevent it, right, 60% of these people would still be here, right? And that's what's scary, right? But again, this is why we're here, right? This is why, in the month of March, right, we say, like, we scream from the rooftops, like, hey, colorectal cancer, something to think about, something to talk about, right? Because I don't want us to get to the point where the only time we're talking about, these diseases, right, is when someone famous, right, gets it, right? Like, or when someone famous passes away from it. But I understand that sometimes that is what helps turn the corner for a lot of people. So I actually have a list, right? I have a list of famous people or famous figures, right, who were afflicted with colon cancer, and some have even died from colorectal cancer. Number one, I would be remiss not to start out with Chadwick Boseman, right? We talked about him last week on Medicine Mondays. Audrey Hepburn, Charles Schultz, who is the famous creator of Peanuts, Vince Lombardi, Elizabeth Montgomery, and I know for a fact I'm dating myself when I mentioned her, Elizabeth Montgomery, but she was the head actress on the show called Bewitched, which was one of my favorite shows growing up. And she was, again, unfortunately, afflicted with colon cancer and actually died from colon cancer. Katie Couric even had her colonoscopy done live, right, on TV, right, because she wanted to promote that onus of colorectal cancer screening. We know Will Smith had his colonoscopy done live as well too, right? So a lot of people are affected by it, but again, famous figures also affected by it as well too, right? So again, it does not discriminate, right? But that's why it takes people like us, right, to be very proactive in our approach of trying to assess and care for patients moving forward. So you may be asking Dr. Bear, right? So like what are the symptoms, right? Like how will I know, right, if I have colon cancer, right? And unfortunately, right, when it comes to colon cancer, a lot of it is asymptomatic, right? So while colon cancer is growing, a lot of people don't experience any symptoms whatsoever, right? Which is probably the most scariest aspect of colon cancer. Because by the time you're symptomatic from colon cancer, right, it's a problem, right? Which means it is at a later stage, right? Again, when we talked about Black Americans, a lot of times by the time they get evaluated for colorectal cancer, it's because they're having some symptoms that they didn't realize, which is why we're so big on prevention, screening, because we know, and it may take 5 to 10 years for colorectal cancer to grow to cause a problem. But we don't want you to wait 5 to 10 years until you have symptoms, right? We want you, while you're asymptomatic, get screened and do the things you can do to try to prevent it so you don't have to worry about it. But let's say you are having symptoms or concerns. Some of the biggest ones I know of, right, are a change in bowel habits, right? This is probably one of the more common questions you will get, right? Have you had any change in bowel habits, whether you're more constipated, whether you're having more loose stools? Those are some of the things that we kind of keep an eye on, right? Especially if you're, before people kind of run to the doctors, right? There are some people who are always constipated, right? Like sometimes, and by constipation, it varies. Because I have some people, like, if they have to have a bowel movement every other day or they don't feel right. Some people are like, no, every 3 to 4 days, then I go, right? But like, if you notice whatever your normal is, there's a change in that pattern, that's something to be wary of. Bleeding, right? Anytime you have any type of change in the color of your stool, especially if it goes black, more importantly, if it goes red, right? If it's red, definitely go see that doctor as well. Abdominal pain, abdominal discomfort is another one. Weight loss is another one. Weakness, fatigue. Like these are just symptoms that, if you're not feeling you're normal, right? Like you should be going to the doctor, right? Especially when we talk about kind of the age aspects of it, right? Especially and we're going to break down some of the kind of the risk factors associated with colorectal cancer, because I think if you understand your risk factors associated with colon cancer, then you understand the need and the urgency to go get screened for colorectal cancer screening, right? So, in fact, we're here right now, right? Let's break down some of the age. Let's break down some of the risk factors associated with colorectal cancer, right? So I'm going to be using Mayo Clinic for our source today, right? And again, we will put definitely the links in the description and show notes as needed. So older factors that increase colon cancer, older age. Colorectal cancer can be diagnosed at any age, but a majority of people are diagnosed older than the age of 50, right? But more importantly, and I want to stress this, right? The rates of colon cancer in people younger than 50 have been increasing, right? And I got some theories behind that, right? So age is definitely a factor. We know that the older you get, the more likely you are to become at an increased risk for colorectal cancer. But that does not mean that if you're young, you're invincible from colon cancer. Again, Chadwick Boseman husband is a perfect example for it, right? And that's where we talk about, especially the African American race, right? Like African Americans have a greater risk of colorectal cancer than other people, other races, right? So just being African American increases your risk for colorectal cancer, right? And again, a lot of different factors there that are kind of intertwined, especially when we think about family history, when we think about diet, when we think about inactivity, like all of these factors there are kind of intertwined with it. But just being African American increases your risk. And reason why we know that, right, is because when we talk about, we're going to talk about the screening aspect of colorectal cancer, we know that if you're African American, we actually expect you to kind of get screening at least 5 years earlier than kind of the general quote unquote population. So personal history of colorectal cancer or polyps, which kind of makes sense, right? If you have a history of colorectal cancer polyps or just colorectal cancer in general, you have an increased risk of having colorectal cancer, right? So these are the people who get the colonoscopy, end up having a benign polyp, right? But because they've had that benign polyp that one time, the risk of getting colon cancer does increase, right? So they have to be a little bit more diligent and get colorectal cancer screenings much more frequently. Patients with inflammatory intestinal conditions, such as ulcerative colitis, Crohn's disease, you have an increased risk for colorectal cancer. Inherited related syndromes, this is where the genetics really play a factor. Lynch syndrome, familial adenomatous polyposis syndrome. Again, these are different genetic diseases that increase your chance for getting colorectal cancer. The family history, again, I'll screen this from the rooftops. If you have a family history of colon cancer, you are going to be more likely to develop colorectal cancer. But this is a scary thing, right? If your family does not get tested, does not get screened appropriately for colorectal cancer, how will you know if you have a higher risk, right? That's why we have to, especially in the Black community, that's why we have to stress, like, get screened, and everybody gets screened, right? Because you need to know if the kids need to get screened earlier, right? Like, again, it's not just about you, right? If you're under a certain age, right, and you get diagnosed with colorectal cancer, guess what? Now your kids are on the clock much sooner than they would typically be. Patients with a low fiber, high fat diet. And this is where some people are attributing the reason why a younger population is starting to develop and have an increased rate of colorectal cancer because of their type of diet, which is typically includes low fiber, high diet. Sedentary lifestyle, right? So people who are physically inactive. Diabetic patients, again, have an increased risk for colorectal cancer screening. Obesity, smokers, again, let's say if this is your first time, listening to me, I talk ad nauseum of the increased risk that smoking places upon your health in general, right? You pick a disease and smoking probably increased that risk of that disease, right? Alcohol use, radiation therapy for types of cancers, right? So these are all different types of risk factors that we know are associated with colorectal cancer. And again, gender as well, too. If you're a man, you're going to be more likely to have colorectal cancer than you're a woman, right? So again, just all these different factors, right? That, again, I'm going to be screaming from the rooftops all this month, right? But really all this year, right? Like if you start fitting some of these patterns, right, you really have to be diligent about yourself, right? Remember our motto, empower yourself for better health. We want you guys to take your health in your own control. But to do so, right, you have to understand, like, there are some times where you're going to be at increased risk, right, for something like this, right? And you have to take the onus to say, hey, doc, like, I got a family history. Maybe I'm not as physically active as possible. Maybe again, my diet isn't the greatest, right? What's my risk for colorectal cancer, right? And that's what I want you to do anytime you watch kind of my series of videos or you listen to me on the podcast, right? I want you to be able to like take this information and then run with it, right, to your health professional, right? To say like, hey, I just heard, this amazing, physician talk about, colorectal cancer, right? And I know this is colorectal cancer month, right? Should I be a person who gets screened for colorectal cancer, right? Like that's my goal, right? At the end of the day, I want to make sure that you guys are empowered to do so. So when we're talking about the risk factors. We talk about the signs and symptoms, doc, where now you may be asking, well, hey, doc, like if I got those issues, man, what do I need to do next? Right. Cause that's the question people always have. What do I need to do next? So, I actually like to refer to the American College of Gastroenterology, right? Again, those, they are a governing body, especially when we talk about all kind of GI things related, right? And they kind of break down the diagnostic testing into two portions, right? So, they have one aspect is the one-step screening test, right? Which is the gold standard colonoscopy, right? So again, that is, again, for a lot of people, it's this dreaded procedure, but it is extremely safe, right? And not only is it safe, right? What I love about it is it's a one-step process in that not only can it diagnose, but it can treat. Right. Because not only can you diagnose, hey, I see some early polyps, right, but you can actually do treatment course as well, too. Right. Versus some of the other testing where you may get the initial response. Right. But you may have to do something else. Right. Which sometimes usually ends up you having to get a colonoscopy anyway. But I have a lot of people who are very weary of getting colonoscopy. I have a lot of people who, again, maybe they can't tolerate a colonoscopy. Right. So they try to avoid as much as they can. Right. So we recommend the stool-based testing. Right. So in my office, when I was in outpatient medicine, we would give patients stool cards to go home with, right? And these were called the FIT test, right? The fecal immunochemical test, which helps detect hidden blood in the stool, right? Because it's obvious, right? If you look in your stool, which I want to stress this enough. There's a lot of people who really don't look into their stool, right? Which is kind of funny. But there's a lot of people who they go to the bathroom, they take a number 2, right? And they never actually turn around to look at it, right? So first of all, don't do that, right? You should, again, I'm not saying every single time you have to look at it, but you should know what your stool looks like. You should know the color of your stool. You should know the consistency of your stool. So if you look and you see it's the quote unquote normal color, right, you may not be alarmed, but these FIT tests are great is that the FIT test can detect blood even if your stool appears normal, because it's very easy to be able to say hey, my stool is red, or hey, my stool is black and I need to go do something, right? But when your stool is normal, right, where again, we talk about colon cancer being a very slow growing process. When your stool is in a normal stage, right, you can still be having some kind of early bleeding from cancer related cells and polyps, but not know it yet because it hasn't really changed the total consistency of your stool. So these FIT type testing, right, or these stool DNA testing, again, these are non-invasive testing. Again, you test the more test the stool for blood. These are great alternatives as well. And when I was in training, they actually started coming into doing image studies, right? Image studies for the colonoscopy, right? So essentially they would get a CAT scan of the colon, right? And they can do kind of 3D imaging to see if there's any areas of concern. Now, what are my, again, I guess the caveats with those, right? And I talked about this earlier, is that let's say you get a stool test that's positive, right? Let's say you get these imaging tests that are positive as well. Guess what? You're going to have to do the colonoscopy, right? So, I always say let's just skip the middleman and let's just go right to that aspect, right? Why do we even have to go ahead and I don't want to say waste my time. Why do I have to do this test if I know if something's positive, I'm going to get the colonoscopy, right? But again, a lot of people are like, yeah, you know what? Maybe I'm not of age yet, right? And we're going to talk about of age as far as when people should get screening. Maybe it's not the time for me to get, officially the colonoscopy, but I just want to make sure everything looks good, right? Then you will kind of go ahead and do kind of these testing here, in that regard. So when should we get screened, right? And I think this is a very important question, because again, I think the age is so huge, right? So the guidelines as we speak right now are recommending that those who are 50, right, with no other significant risk factors, indicators, signs and symptoms, again, bleeding or any of those types of things there, you should wait to the age of 50. But we do have some consensus now, which I'm loving, that's kind of recommending, we probably should push those to 45, right? So I think eventually, especially in, a few years, it'll be almost official that by the time you're 45, you should be getting a colonoscopy, right? But remember, especially for my African-American community who are watching me, when I talk about risk factors, remember being African American is a risk factor, right? So if the general population is 45, 40 years old is when you really should be thinking about getting a colonoscopy and getting screened. Again, because the risk factors are unfortunately against you, right? And we already know that being Black means that we typically are diagnosed at a later stage. And if we're diagnosed at a later stage, that means we have less treatment options available to us, right? And I don't want us, especially when it comes to colon cancer, right? Especially when we know 60% can be prevented, or 70%, depending on who you're talking to, right? Can be prevented with just proper screening, right? I don't want us to have like that end of the bag, right? Where we're just being diagnosed when the cancer is a late stage, or there's about 4 different stages, colorectal cancer care screening. Not really important for us to know right now, but just understand that stage 4 is a bad stage, right? That's a stage we don't, want to typically be diagnosing people. We want to diagnose people in the earlier stages, because we know the earlier stages have better treatment options for us, right? And again, treatment options could be either, especially if you're doing a colonoscopy and you see these kind of precancerous lesions, aka these polyps, removing said polyps. But again, if it gets to the point where maybe you're at a later stage, sometimes you need surgery, sometimes you need chemotherapy, sometimes you need radiation. Like I said, not really important for this topic here. It's just understanding that when we talk about colorectal cancer, right, it is something that we have to be very diligent in combating, right? Because we know if we're aggressive, right, if we increase our physical activity, right, if we increase our vegetables and increase our fiber intake, decrease our fat intake, right, if we get these screenings like we need to get, right, if we're more proactive, right, in educating and recognizing signs and symptoms, right, and we know if we do these things, right, we can prevent the end result, right, which is people not being able to live, right, with their colorectal cancer, right, because they pass away from it, right, because they caught it too late, right. We know we have to be proactive, like I said, empower yourself for better health, right. We have to make sure that we are doing what we need to do, right, to make sure that at the end, right, like we catch this early, right. And so again, like that's my take, right. That's colorectal cancer from yours truly, Dr. Pierre. Again, catch us next week, where again we're going to be talking about all kind of things, kind of again associated with the month of March. You guys be blessed. Have a great day.
Thank you for coming to the end of the episode. It is yours truly, Dr. Pierre. I want to give my undying thanks to you for your support. Just getting to the end of the episode means that you at least enjoyed today's episode. Hope you were empowered by today's episode. Please remember to share this episode with at least 2 people that you know that would be greatly affected if they did not listen to today's episode. And if you have not already done so, subscribe to the podcast. Leave us a 5-star review, especially on Apple Podcasts or wherever you can leave a review. Leave a review there, because your support is so valuable for what we're doing here on the Lynch Learn and Everything with Pierre Medical Consulting. And if you have not done so, go ahead and join the listserv. To join the listserv is very easy. Just grab your phone right now. I'll pause. Join the listserv. You want to text Lunch Learn Pod. This is all going to be one word, Lunch Learn Pod, to 44222, and you'll be on the listserv. You'll know exactly when new episodes are coming out. You'll know about new episodes before they actually come out, because I usually tell my listserv members, hey, this is what I'm working on. These are the guests that you should expect to hear for the week on. Thanks, guys. You have a blessed day, and I'm going to see you guys next week.